So now I'm going to go through the levels of the hormone in the menstrual cycle on this diagram. FSH is released from the anterior pituitary at the start of the menstrual cycle, and this causes the development of the follicles. FSH slightly spikes prior to ovulation. Estrogen is released by those developing follicles, and it gradually rises as they develop and then falls just before ovulation as the follicle prepares to release the egg. Luteinizing hormone doesn't really change much until it spikes just before ovulation and stimulates that ovulation to happen. There's only a very low level of progesterone during the follicular phase, as it doesn't really have a role during this phase. Progesterone, and to a lesser extent estrogen, are increasingly produced by the corpus luteum. These hormones help to thicken and maintain the endometrium. Unless fertilization occurs, the corpus luteum degenerates and the progesterone and estrogen levels drop. This drop in their levels results in the endometrial lining breaking down and menstruation occurring. The levels of progesterone and estrogen are high during this phase. This causes negative feedback that prevents FSH and LH from being secreted. But as they drop at the end of this phase, this removes the negative feedback on the hypothalamus and pituitary, and FSH starts to be secreted, and this is where the cycle restarts all over again. So if we find somebody who's not ovulating, we need to find out why they're not ovulating. And the most common cause is polycystic ovarian syndrome. Remember that polycystic ovarian syndrome is a triad of anovulation, polycystic ovaries, and hirsutism due to high levels of androgens or male sex hormones. A history of facial hair, acne, irregular periods, and typically raised BMI are suggestive, and we can confirm the diagnosis of polycystic ovarian syndrome with a history and also with an ultrasound of the pelvis to see the cysts in the ovaries. We can also check luteinizing hormone along with the FSH on day 2 to 5, and luteinizing hormone will be raised in polycystic ovarian syndrome. We can also test for androgen hormones, which will be raised in polycystic ovarian syndrome as well. Another cause of anovulation is hypothalamic amenorrhea. This is basically where physiological stress causes the hypothalamus gland to stop producing GnRH, and the result of that is that you don't get the gonadotrophins that stimulate the ovary to develop eggs and release them. This can happen if the body is under a lot of stress, such as with extreme diets and exercise, low BMI, chronic disease, or significant psychological or lifestyle stresses. Another cause of anovulation is endocrine disorders such as hypothyroidism or hyperprolactinemia. If you get a high prolactin level, this is usually caused by a prolactinoma, which is a benign tumour of the pituitary gland, and it secretes the prolactin hormone. The person may have symptoms of galactorrhea, which is where they produce breast milk. They have amenorrhea and reduced libido, and they may have symptoms of the tumour if it grows large enough, such as headaches or cranial nerve palsies. You can investigate this by checking the prolactin levels in the blood and doing an MRI of the brain to see whether you can find the tumour.